see they got a method to their madness.
It's an incentive. We had 11 or 12 people in here the other day.
Okay, wonderful.
I guess you're allowed to. I guess the 10-person it's over with now.
Are we ready? We're ready.
You ready? I'd like to call this July 21st meeting of the Kent County Commissioners to order. Let's stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's have a moment of silence tonight for the family of Terry Batchelor, who passed away this past week, the longtime conservationist and forester here in the county, and also for the passing of a longtime congressman, John Lewis. Thank you. We are live streaming our government operations here tonight. To call in, you dial 1-872-239-8359, and you enter conference ID 632-958-639 hashtag. I'd also would like to briefly go over again the procedures for public comment. It's our desire that everyone who wishes to comment be given a fair and uninterrupted opportunity to express their views to the County Commissioners during this public comment period. Comments will be limited to 3 minutes in length. Comments longer than 3 minutes will be required to be submitted in writing. The board president will open the meeting to public comments. Citizens are asked to state their name, address, and the topic of interest. Citizens are to ask that all views be expressed in a respectful and civil manner. The board respects your desire and right to convey your messages freely. We ask as a courtesy to the board and our citizens that you respect the Commissioner's request to refrain from naming citizens and name-calling when offering any critique. The county staff will acknowledge each caller in the order they called in, announce the last 4 digits of the phone number that was used to call in, and will ask the caller to unmute their phone, allowing them to comment. Okay, tonight we have a COVID-19 update from Mr. Bill Webb, the health officer here in Kent County, and Wayne Darrell, our Director of Emergency Services. So, Mr. Webb, the floor is yours.
Thank you. I want to thank the commissioners for the opportunity to address the community. I do want to praise our partners in the Emergency Operations Center as we deal with this crisis on a day-to-day basis. The health department could not do all of the work that has been done without the support of the community and our members in the Emergency Operations Center. Overall, Maryland conditions as it relates to COVID-19 have been deteriorating in the last 3 weeks. Case counts have been climbing steadily since the 4th of July weekend. Sunday marked 925 new cases in one day, a milestone not seen since the end of May. Maryland hospitalizations, fortunately, have been trending only slightly upward. The Department of Health epidemiologists last week identified, a problem, identified 18 to 34-year-olds as a driving force in our recent trends, especially those who have been frequenting bars and restaurants. They traced many cases to those who frequented bars and restaurants where compliance with social distancing and facial coverings has not been rigorous. Positivity rates among this demographic were 84% higher than the general population, so it's substantially higher. Nationwide, the situation is substantially worse. Daily, our country is posting record numbers. Florida, Texas, Arizona, and California are leading with counts that are staggering. As a country, we are now in the midst of a surge in cases that was predicted when restrictions were relaxed in May. The situation is bad, and the models indicate that the virus is outpacing any benefits we might have accrued with the spring shutdown. Fortunately, Kent County has fared a little bit better than Maryland and other midshore counties, but we're not immune. Our case counts have risen significantly in the last week. Kent's positivity rate has doubled since I last reported on the situation. In April and May, cases were predominantly localized in nursing homes. Today, community spread outpaces facilities at a rate that is 5 times higher community spread. For me, the situation today is significantly more alarming than it was in mid-April. Kent usually lags other regions in our state, so I predict that the counts will continue to surge in the next 2 weeks. So if we can go to the first slide. The first slide is a total case counts in Kent County. The graphic is furnished by the town of Chestertown, and I want to thank them for the work that they've done putting this in. We have 223 total cases. Since I last reported to you, we have 25 new cases. The good news of the report today is we have had no additional deaths as a result of COVID-19 since June 30th. Our facilities, we've had 4 facility-related cases, 2 at the resorts at Chester River, and 2 at the Kent Center. The Kent Center is a new outbreak for us that we learned about on Monday. Community spread, we've had 21 new cases since I last reported. All told, out of the 223, 198 cases have been resolved. If we can go to the next slide. The new cases in the last 14 days, you can see that we've had 16 new cases in the last week, and this was as of Sunday, or as of Monday, today, we have picked up 4 or 5 additional cases. So the trend is continuing upward. If we go to the next slide, this is just a comparison with the state of Maryland. As you can see, the important graphic there. Look at the yellow lines. The yellow lines underneath the blue. That indicates the positivity. The positive cases as we're moving through, and there has been a trend upwards since the 4th of July weekend. So, speaking of positivity, if we go to the next slide, the red line indicates positivity rate, 7-day positivity rate for Kent County, and the blue line indicates the statewide rate. As you can see, for much of June, we were well below the state average, and we have, just recently in the last week, we have come back up to the state average. Today, our positivity is at 4.9%. So that means that just about 5% of those people that we test end up being positive. We have, if we go to the next slide, how many of our folks have we tested? Kent County is doing well. We are third highest in the state for the percentage of population that we have tested. We're currently at 17.1%. So I guess what I wanted to talk about here related to our most recent cases, what we have found from contact tracing is that 6 of our cases occurred in 2 family units that had participated in family gatherings over the 4th of July weekends. 3 of the cases occurred in people who were cohabitating. They were unrelated, but they were cohabitating with each other. 2 cases were related to occupational exposure, and 10 of the additional cases were of unidentified origin, which is the most difficult. So we try to track down where did the individual come into contact with someone who was positive, and where do we think they got it. And for 10 of the 21 cases, we could not find a direct link with someone. So that is typically an encounter that's happened in the community or that they've had with another person in close contact. And as I noted, the community spread rate is going up significantly, and it's very as we're encountering more cases where we don't know where it came from, it becomes more alarming. Just to give an overview of the race information related to our positive cases overall. This is Kent County cases overall. We have seen higher than expected numbers in the non-Hispanic Black community, and we've also seen substantially higher numbers in our Hispanic community. The members of the white community, Asians, others, and we have about 10% where data is not available. So let me just talk about our community testing at this point. We have tested 774 individuals since we have transitioned back to testing locally in Kent County. Our positivity rate is at about 5%. It's a little bit above the state average. When I talk about hospital capacity, the University of Maryland Shore Regional Chestertown has seen an increase in admissions and ICU utilizations in the last 3 weeks. Fortunately, they have not needed to mobilize their surge capacities as far as I know. To briefly mention our nursing homes, 2 facilities have successfully entered the first phase of reopening. That would be Heron Point and Peak Healthcare, and the good news is Heron Point will be eligible to enter the next phase of the relaxation of restrictions on Thursday, and we're hopeful that we can get that moving forward for them on Thursday as well. Our testing site, we moved from the Public Works building on July 9th to our office-based testing strategy on Washington Avenue. We're able to test approximately 65 people a day. We're doing it 2 days a week currently for a total of 130 tests a week. The demand for tests is increasing. We are regularly filling up our daily slots, and results, fortunately for us, results typically take 2 to 3 days to return. And for many jurisdictions who use large national labs, they have experienced substantial delays, 10 to 14 days to get results, and that's just unacceptable, because why even bother testing if you can't get results back by the time the quarantine period has been lifted. Okay, so the health department, the Kent County Health Department testing strategy, we want to do it in 2 ways. We want to have an office-based testing location that we have now, and we also want to have a mobile testing capability where we can go out and respond to hotspots. We were in the process of hiring 2 nurses to staff the mobile unit. Unfortunately, they backed out at the last minute, so we're going to have to go back to the drawing board on that one, and hopefully we will have a solution in place by the next time I address the community. The good news related to testing is that the University of Maryland Shore Regional Health has decided to open its own testing facility at Chesapeake College for the 5 counties of the region. They are stepping up to provide community testing. The health department is encouraging that activity. We are supporting them by providing contact tracing and notifying people who were tested with their results. Our contact tracing staff has been augmented by 2 individuals since we last spoke. We're finding that community spread cases are typically much more complicated than those that are in facilities. One of the trends that, as I mentioned, that we're seeing is a younger demographic, and we're also seeing it in individuals who are visiting family members in small social gatherings. So the cases where we are able to identify where the exposure happened, many of them have happened in family gatherings or small social gatherings where they're not expecting, it's not large crowds, it's not necessarily bars and restaurants, but at picnics and barbecues that happen over the 4th of July weekend. I want to briefly mention enforcement activities. Last week, the governor sent county leaders, called on county leaders to increase enforcement activities related to face coverings and social distancing in retail establishments. The health department has a plan to hire a dedicated enforcement staffer to work with our environmental health staff using our CARES funding. And we're looking at reassigning one of our drivers for adult daycare, who is a retired state police officer, to help us do those enforcement checks. And we're interested in working with the county and the alcohol control officer, Mr. Ober, to increase our presence and do spot checks on the street, because we really think that is important to help minimize the spread of this virus. Just a brief update on CARES funding. At this point, the health department has paid out a little over $215,000 of invoices for county and municipal public health spending. Just a reminder to encourage all of our agencies moving forward to proceed with the spending and do the approvals as you're well aware. Just wanted to give you an update on where we were with spending the money. The health department at this point, our CARES spending is significantly higher than we expected. We've had to hire staff for testing, contact tracing, translators, and also for our enforcement person, and that's higher than we originally anticipated. So what I want to talk about now is the health department's immediate challenges as we go into this period of rising cases. One of our biggest challenges right now, and one of the hottest debates in the community, involves school operations. Schools open in approximately 4 to 5 weeks. Many of the details about how this is going to happen are still pending. Infection control and outbreak response procedures are still in the early stages of development. The school health program that is run by the health department has been chronically understaffed in just normal years. This is not a normal year. We've made a request in February for additional personnel, and we were denied. Outbreaks in the school setting this year will likely overrun our capacity in the school health program and will require the health department to stop its regular services to free up our staff to respond to schools. At this point, I would strongly advocate that Kent schools proceed with an online learning for the fall semester. Washington College is also another challenge. It's coming back online in September. They plan to bring 846 students onto campus starting in August, with 200 more living off campus. Fortunately, their testing, quarantine, and isolation procedures are in the final are in the final stages of development and likely will be published shortly. In-person education at Washington College, from a public health perspective, represents an influx of the most mobile and effective demographic that we have right now. So, our community is going to need to be aware of the movement of students and being very vigilant about face masking and social distancing. The 1,000 or so students we're talking about represents a little over 5% of Kent County's population, and it is, we're partners with the college. We want them to succeed. We want to have the students in the community, and I think that they're doing a very good job of structuring how they're reopening with their living accommodations and their infection control practices to minimize the risk to the community. And then finally, our ongoing immediate another challenge that we have is encouraging citizens of the relevance of face masks, social distancing, use of hand sanitizer, and responsible personal choices. It's all about responsible personal choices. We routinely field calls about folks who feel that face coverings and social distancing are an imposition, when, as the evidence shows, it is beginning to gather that those methods really do work. In closing, I just want to say that we're early in a new surge of cases. Reimposition of statewide or federal restrictions are unlikely. Kent County may have to consider imposing restrictions and regulations in the absence of outside leadership. We face many difficult decisions about opening schools, allocating our testing resources, and ensuring our healthcare system can cope with the surge. Evidence is growing that face coverings make a significant difference in the transmission of the virus. As leaders, we need to double down on their necessity in spite of waning popular support. Local action may be needed if conditions get worse. Our community's success with the actions and personal responsibility, our community's success will rest with the actions and personal responsibility everyone takes. I urge all to please continue to wear face masks, stay at home if you are at high risk, wash your hands, and keep your distance while you're socializing. Your efforts make a difference. These measures work. Thank you.
Mr. Webb, didn't they, 4 or 5 counties today, Baltimore County, I think, made some changes as to their operational policies with maybe doing away with inside dining and stuff?
So the one that I'm definitely aware of is Baltimore County has mandated indoor face coverings in indoor public spaces. So, it's more than just retail establishments. It's recreational facilities. It is office buildings. It is, anywhere where you may be inside, and it's not a private space. I know that the health officers in the central region of the state sent a letter to the Deputy Secretary of Health urging the governor to take statewide action to roll back some of the relaxation of restrictions. They have seen a significant increase in cases, and the problem is with this particular virus, when you get infections, it's exponential growth, and it goes up a little bit and then it spikes way up. And my colleagues really do feel that they're right at the beginning of when it's going to go significantly up, and that's why they're asking the governor to make those changes. I know that locally on the Midshore region, Queen Anne's County has had to close a number of restaurants in Kent Narrows because of infections, and in Talbot County they have seen an increase in cases, and just today there was a cluster of 40 cases in Dorchester County, and I have not gotten additional information yet about what that involves.
You said the University of Maryland's going to open up testing at Chesapeake College. Are we still going to continue our testing here?
Yes,
So there'll be two places.
yes. We need all the capacity we can get, and one of the strategies that has been discussed in public health circles is the process called batching tests. So essentially, you swab everybody who lives together in a building, and then it's one test that's run from the solution that they get out of the bottom of the test tube. And if it returns a positive, then everybody who's in that residence is considered positive, or they do additional testing. It's a way to increase the amount of testing without needing additional testing supplies and reagents that are in short supply.
So how do they count those? If you have 5 people in a house and you're swabbing everything together, then is that getting reported as 5 positives?
So that what happens is that then you do a second round of testing.
And the second round is when they individually,
Correct.
and then they would count that one.
Correct. And when, right now, our positivity rate is only about 5%. So it helps, if you have a group of negatives, then it helps rule out those individuals so that you can really focus on those who have infections.
Okay, well, that makes sense, because then you test 5 people with one test, and if they're all negative, then you can save these other tests for another group that may be positive.
Correct.
I was just making sure that I was just curious if they were counted as, but they're not.
I mean, they're follow. It's a follow.
So they do the follow up where they individually count.
Any other questions? If not, thank you. I guess, Wayne, do you have some follow-up?
Yes, sir. Bill covers everything really well. Continue to stop, respond to DUI cases in the EMS. They're doing well. Any questions for me?
Okay, thank you.
Thank you both. Thank you for the work you're doing.
You can read it later. Go ahead. Thank you.
We have several consent items. We have the regular session minutes from July the 14th, the liquor minutes from July 14th, and then the Rock Hall Volunteer Fire Company's combined gaming.
Motion to approve.
Second.
All those in favor say aye. Aye. Now we have a special Class C license for the Rock Hall Volunteer Fire Company.
Motion to approve. Second.
Is there any other question? This is for July the 25th. All those in favor say aye. Aye. I'm sorry.
Gonna make a motion to go legislation.
Prior to legislative session, you may want to consider rearranging the agenda since Shelley is here.
Sorry, I couldn't.
No,
We're
want to go to.
going to go
Shelley
to the
Neal
legislative
Edwards.
session. I mean, we're all right. What we
No, we're going to skip that, go to Shelley Neal, and
Oh,
then go back.
okay. I'm just a little dense. Okay, next we're going to go Shelley Neal Edwards. I'm sorry, I just didn't get it.
Oh, no.
Didn't get the hand signal messages.
Well, good evening. Thank you for allowing me to give you some information. So we have been working for months on getting this memorandum of agreement through, I think I had presented to you all in February, maybe, about the summer SNAP program. So we did some reconfiguring of numbers and found that we were able, I think people moved out of the county or children aged out, and we are now able to, with the 170 children that we had proposed to serve for the summer, with the Rock Hall zip code, but also the Millington zip code, which will include for the 170 children that we had talked about. So this memorandum of agreement is between the Department of Human Services and the Kent County Commissioner's Office. So basically all we would need to do is the county government give us a one-time invoice for the $8,500. We will then we will be, and then provide us with the funds, and we will be able to give $100 to 170 children for the next year, for June, July, August, and December. Now with COVID, things have changed. Of course, this was prior to COVID, but this would still be that these children, these vulnerable children, will get the $30 for June and $10 for December. So we have I have 2 copies of the MOA, if you agree with and would be able to sign it. But I also had included, we are providing, we're letting the Rock Hall zip code families and the Millington zip code families know that this is available and this is what they will be getting. And this kind of gives them information that's going to be added to their SNAP card currently, and they will have access to that. And there is, since COVID, there has been some piloting. I think Walmart actually is, and Amazon are 2 vendors of actually delivering groceries. I'm not sure if it's available in these 2 zip codes yet, but eventually it will be. So for meal delivery. But I just wanted to be able to give you this information that we have finally got this up and going, and we will be getting this MOA, and I didn't know if you had any questions about it.
So actually, they'll be getting, because we're 2 months into it, essentially, or
Yes.
a month and a half into it.
Yes.
They will get it from arrears. I mean,
Absolutely. They will get it in August. Once we get this signed and implemented, they most likely will be getting it in August for June and July. And then in August, they'll be getting August, and then in December, they'll get December's. But COVID has kind of put everything on hold for everyone, so that is why it was kind of pushed back. But I didn't know if you had any questions, if this is okay. Can I leave? Do you want me to leave these and then?
Well, I'll make a motion to approve and to make sure we sign it.
yeah.
I'll second it.
Is there any other question? If not, all those in favor say aye. Aye.
Thank you very much.
You want to go back to the,
Read something for, I can't remember. Just make a motion to go in legislation.
yeah. Make a motion to go into legislative session.
To go in legislative session.
Second.
Favor say aye.
Aye.
Okay. So now we have an application from Rock Hall Volunteer Fire Company for let me get this.
We're going into Rob Tracy. We done that.
No, wait a minute. No, we haven't done this, have we?
Yeah, we did.
Did?
Hector, you off your regular rhythm.
All right.
You did approve it then.
We did?
You did,
Yeah.
yes.
And then because we did all 3 together, then I made a
I'm
motion.
going to tell your wife about this too, but this will probably answer a lot of her questions.
Well, I looked at this and I didn't think they were the same things.
Listen, one of them is a game, the one up top is a gaming device, and this one is a beer, wine, and liquor.
License, which we did. When did we do it?
They slid it right in there.
We slid it, we did it all together.
Did it?
You're outnumbered. We did it.
All right, we did it.
Votes against you, Tom.
You know what? We've done everything else on this agenda. Thank you for being here. You have a motion to adjourn?
Bob made the motion and Ronnie seconded.
Yeah.
Well, you voted on it.
They did vote, yes.
If you,
So we are in legislative session.
Legislative session, yes.
Sorry, Shelley apologized for throwing you off your game, Tom.
Tom's wife's been talking to me about this stuff. I mean, the lack of memory and stuff.
Yeah, well, just keep it to yourself. All right, okay,
And then we went into the legislative session, so that's where we're at.
that's where we are. So we have Rob Tracy.
We've been seeing a lot of you over this last month or so.
And for a while, you were thinking it might have been too much, wasn't it? We're not talking about ag preservation tonight, anyhow.
No. Good evening. So I'm here tonight to introduce proposed code home rule on microbreweries and Class D alcohol retail businesses in the Crossroad Commercial Zoning District, and to request a public hearing for the proposed bill on August 11th. On March 17th, 2020, Mr. Richard Carter proposed an amendment to amend Article 5, Section 10 of the Crossroad Commercial District by adding 10.221 microbreweries as defined by the state of Maryland, and by adding 10.222 Class D alcohol retail businesses as defined by the state of Maryland. Microbreweries are a permitted use subject to site plan review. Commercial zoning districts subject to site plan review. The Class D alcohol retail business as defined by the state of Maryland would allow the applicant to sell beer, wine, liquor, and liquor to adults 21 or older for consumption on premise. At its meeting on May 7th, 2020, the King County Planning Commission conducted a public hearing and reviewed home code rule bill. The Planning Commission voted unanimously to send a favorable recommendation to this body. Microbreweries are permitted use in the commercial district. The proposed amendment would expand this use to Crossroad Commercial Zoning District. The Crossroad Commercial Zoning District currently allows restaurants without drive-through service and retail businesses as a permitted use. Under state law, microbreweries have a limit on the amount of beer that can be produced each year, as well as the amount that can be sold for consumption on premise. The first proposed new use in the zoning text amendment would allow for brewing and tasting of beer produced on site. The second proposed use, Class D alcohol retail businesses as defined by the state, would allow a license holder to sell alcohol beverages not produced on premise to adults over the age of 21. The applicant's narrative related to the proposed zoning text amendment states that selling other locally crafted beverages from a microbrewery tasting room could help promote and market the microbrewery industry on the Eastern Shore. Microbreweries allow for the development of small, locally owned businesses, and the tasting rooms potentially support tourism by creating another activity to draw visitors to the community. This use adds additional flexibility to the Crossroad Commercial Zoning District. Happy to answer any questions you have. Thank you.
And all you need from us is to agree to schedule a public hearing.
Yes, sir.
Motion that we schedule a public hearing.
I'll second it.
Is there any other question? If not, all those in favor say aye. Aye.
Thank you.
Okay, thank you.
Set up here.
Yeah, that was simple. Yeah, we'll find something to pick on you about.
Out of here that easy.
You have a good night, Rob.
Yep, thank you. Okay. Now, my agenda says Bill Mackey, but this doesn't look like Bill Mackey. So Stephanie, you're the new Bill.
No. I'm here to introduce another zoning text amendment to you. This would be for campgrounds. You've seen this before. In March, you all adopted Code Home Rule Bill 1-2020, which allowed for campgrounds in the resource conservation area to expand. It also added the definition RVs to campgrounds. So with that,
because this is part of our critical area program, it requires it to go to the critical area commission for review and approval. So on June 3rd, this was heard by the critical area commission. They approved it with conditions. And basically those conditions are what is reflected in the zoning text amendment. So what they had basically indicated was in Article 5, Section 2 of the Resource Conservation District, what you had approved in March was to basically include campgrounds in a list of already existing non-conforming uses that could be expanded. What the Critical Area Commission condition is that we remove that and have campgrounds be in their own list, listed as their own use. It still is campgrounds existing and in use as of August 1, 1989 in the RCA, or in the Resource Conservation District, so it still has all the implications of it, what it did before, but it really has its own use. But this all says it shall require growth allocation. What it was listed before, it says it may require growth allocation. So what it was is they want to be sure that it requires growth allocation. Also, because of the way the ordinance is outlined, they also had to add a section in our environmental designs standards for growth allocation, because the way, I guess the standards for RCA, which is our Resource Conservation District, in line with the intense development area. We don't have an intense development area that's a Resource Conservation District. So IDA is a critical area designation. And this allows basically to have IDA standards within our Resource Conservation District. So it allows them to have an increase in lot coverage, which without this addition of growth allocation language, they technically wouldn't have been able to have lot coverage over 15%. So that's basically what this zoning text amendment is for. Basically, it went back to Planning Commission then in July. They sent a favorable recommendation. Basically, the public need was based off of basically the state's requirement, something that we had to adopt. So therefore, basically the staff recommends introduction of that text amendment to move forward.
I'll make a motion to approve this to go forward, have a public hearing scheduled.
Second.
Any other discussion? If not, all those in favor say aye. Aye. So you're good?
Yep, I have the next one too.
You have the next one too?
Yep.
You're billed twice.
I'll let Bill be Bill on the next one.
Oh, okay. He's going to be Stephanie. Okay.
Motion to go back into open session.
Okay.
Leaving legislative session, going back into open session.
Second.
All those in favor say aye. Aye. Okay.
All right, so what you have before you is our growth allocation policy, and this would be an amendment to the growth allocation policy itself. This kind of follows the same path as the campground. In March, you approved a updated version of our growth allocation policy. Therefore, because it is part of our critical area program, it has to go through the Critical Area Commission. Basically, they approved it, but with conditions like the campground. So therefore, those amendments to our growth allocation policy, they're merely just for reformatting purposes, so it aligns with the critical area law and then also our existing text. Also, they included a COMAR reference, which was already included in the growth allocation policy in another location, and also that it had to require just the way that, give me 1 second. In order for a IDA, which the growth allocation policy allows for critical area designations to go from RCA to LDA to IDA, and the way that the county can award growth allocation has to meet certain standards. So what it is one of the standards is they've added that public water and sewer has to be included in that, so that's pretty standard. But that's the only other changes to this policy change, I guess. And with that, Planning Commission reviewed it and also sent a favorable recommendation, and staff recommends the revised policy.
You said one thing there that I don't, the part about public water and sewer has to be available to.
So that is strictly for the part of the growth allocation policy where new IDAs shall be located in an existing limited development area.
For new IDA, okay.
Yep.
Okay.
So to go from technical LDA to IDA is what that is.
So I'll make a motion to schedule a public hearing for the proposed amendment to be held on August 11th, 2020 at 10 a.m. in the Commissioners' chambers, including remote participation by the public at the hearing.
Second it.
Is there any other discussion? If not, all those in favor say aye. Aye. Thank you.
Thank you.
Pop the mask.
Steph?
Thank you.
We're now ready for, I don't know who. This is Bill Mackey now.
Stepping up to the podium.
Stephanie Jones or Bill, whoever you want to be, we're all right with tonight.
Thank you. We were arranging the items, we weren't 100% sure who would be available tonight, and having Stephanie here as the expert in these areas I thought was important, so. Thank you very much. And I'm here tonight to speak with you about the CDBG program. You all were gracious enough and adventurous enough to approve a grant application, and the Maryland Department of Housing and Community Development has approved a grant, not for as much as we asked for, but for $134,146.39. In order to receive those funds, we have to sign an agreement with the state. That agreement is attached for your reference. And essentially this grant would, the funds would be passed through the county to the Maryland Rural Development Corporation for an emergency rental assistance program, and through Upper Shore Aging for senior food services program. So those are items that were part of the application. They were approved for less than was requested in total. There's a variety of documents within attachments that need to be signed. Those have all been flagged for you. And I think as we mentioned before, as a grantee or a recipient of the grant, we are beholden to the federal government and the state to make sure that a variety of provisions are enforced in the county, things like fair housing, etc. For this particular grant, I will be working with the state to make sure that we have all those parts in place. You'll be receiving a variety of items over time, or you'll be approving things like fair housing plans, women and minority-owned business programs, things like that. So all those are standard parts of the process. I know this county has had all those things in place previously because you previously received CDBG. Generally, those plans get updated every 3 to 5 years, and it's been some time, so we'll have to walk through those. However, the document before you tonight is simply the grantee agreement for the receipt of funds. Staff recommends approval.
Motion to authorize and empower the President of the Board to sign and execute the grant agreement for Maryland CDBG Program Grant Number CV1-7.
Second that.
Is there any other discussion? If not, all those in favor say aye. Aye.
Thank you very much.
Okay. Okay, next on our agenda is the Coronavirus Relief Fund. I guess, Shelley, do you have?
And tonight there are no requests under this agenda item category, but there is the spend plan spreadsheet for your review. no action.
All right, if nothing's changed since the last time we saw it.
I do have 2 action items for you this evening. The first is on behalf of the Sheriff's Office. Federal law authorizes the Attorney General to share federally forfeited property with participating state and local law enforcement agencies. Through equitable sharing, any state or local law enforcement agency that directly participates in a law enforcement effort that results in a federal forfeiture may either request to put tangible forfeited property into official use or an equitable share of the net proceeds for the of the forfeiture. To remain compliant and eligible to receive sharing, there must be a submitted form through the eShare portal, and it must be accepted by MLARS within 60 days of the close of the fiscal year. So the agreement is called the Federal Equitable Sharing Agreement and Certification, and it is in front of you this evening for approval. And just to let you know, this is an annual certification that must be signed in order for us to participate in the program.
Motion to approve.
Is there any question? And I might ask, so here on the certification report, I mean, we were talking about $1,096, is that, and now what are, these are items that are confiscated or seized when someone's arrested?
And in order for us to participate in the program, there's a list of terms and conditions that we have to abide by, to agree to abide by, and that's what this
is. All right, all those in favor, say aye. Aye. Okay.
And the second item that I have for you this evening is Maryland Environmental Service, that runs our Landshore, Midshore landfill, would like to capitalize on the low interest rates that we are experiencing right now. They would like to reissue the 2011 series bonds in order to get a better interest rate. The documentation has been vetted through our council, through their bound council, and is recommended for approval this evening.
Motion to approve. Second.
Is there any other discussion? If not, all those in favor say aye. Aye.
Okay, and just to clarify, that is a resolution that will put the wheels in motion. I have 2 items in the report section. The first is the letter that Mr. Webb referenced earlier. That is the letter from Governor Hogan regarding stricter enforcement of the social distancing and mask mandates. And the second is a thank you letter from Susan O'Neill, who is the Executive Director of Upper Shore Regional Council, for your annual allotment to Upper Shore Regional Council.
Okay, that's it. All right, so I guess we're at the point of our meeting for public comment.
We don't have anybody.
There's no one on the phone?
No.
There's no need me reading this procedures if there's no one there. So I guess we have a closed session. I guess we need to
We got a paper.
close session.
Motion to go into closed session to discuss personnel. And the reason for closing, matters relating to personnel are confidential.
We need a second. All those in favor say aye.
Aye.
Okay, so we will now go into closed session.